ADHD has become a really significant problem for a lot of kids and families. We're up to now almost 12% of school-age children are diagnosed with attention deficit hyperactivity disorder.
Psychologist Dr. Beurkens has been working with children and families for more than 20 years, diagnosing ADHD and finding ways to help kids cope.
That it's not just that this name that we give this disorder is one thing and all kids who have this look the same and have the same underlying issues, so the individualization of treatment becomes really important.
Dr. Beurkens has spent the last several years working with parents like Teresa Dote, whose child was diagnosed with ADHD at a young age.
Hope has always been kind of a challenging kiddo, always constantly in motion, always very strong-willed, wanted her way, very determined kiddo.
A young girl with a big heart who struggled to complete everyday tasks.
So if it was, got your coat and your shoes on, she might start towards that, but then lost focus and couldn't complete that task.
That's when Dote said she started seeking help for her daughter.
It's tough for parents because when they notice that something's going on with their child, everybody's sort of familiar with ADHD as being these really hyperactive kids who don't stop moving, and certainly that is some kids, but that's not the only symptom of that.
Hope started with counseling and visits to psychiatrists who all tried different medication.
We found that a lot of the medications brought about just a lot of side effects.
Until she finally made her way to Dr. Beurkens' office, who was able to provide some treatment without any medicine.
For a lot of kids, medication either doesn't really do anything for them or they experience a lot of significant side effects.
It could be their diet, a food allergy, or even a lack of sleep.
25 to 40% of children diagnosed with ADHD actually have an undiagnosed and untreated sleep disorder.
Dr. Beurkens also says kids who have lost a loved one or are being bullied may also show symptoms similar to ADHD.
So it becomes really important to not just stop at, oh, this child meets the diagnostic criteria for ADHD. ADHD is a name that we give this set of symptoms, but the reality is there are probably dozens or 100 or maybe even more specific types of issues that fall under that umbrella of ADHD.
As for Teresa, she's just happy that having her child see a psychologist has allowed her to get her daughter back.
It's changed, obviously, her ability to be successful at school, to be able to grow and learn. And ultimately, she's happy. And she's outgoing and silly and is able to be a 9-year-old kid.